Hey everybody, how's it going?
Hi, Scott.
Can you hear me all right, everybody? Anybody out there? All
I can
right,
hear you loud and
thank you,
clear.
Alexis. All right, well, welcome. My name is Scott Larsen. Let's get started. Today, we're going to be talking about a very important topic, one that I would say is critical to have a pretty good understanding of, which is how to deal with your body when you get injured. And injuries happen unexpectedly, sometimes unavoidably. So they're going to happen. You need to have a strategy in place to deal with it when they do occur. So the reason I bring this up is most people don't have a strategy. They just kind of suffer an injury and then wait for it to heal. But injuries can be dealt with in a strategic way that can actually make your body stronger post-injury. So believe it or not, do implement some of these strategies, maybe not all of them, but at least a couple. An injury can result in a healthier body, believe it or not. So you can use these little injuries to your advantage, and I'm thinking sprain, strain injuries where maybe you step wrong off a curb and tweak your ankle, tweak your knee, hurt your hip, hurt your back. Maybe it's a more invasive thing like a car accident where you're injured in more of a traumatic type of an injury. It could be a repetitive stress injury where you develop pain from your activities that you do every day at work. It could be a number of things. You could have posture related injuries that start becoming more frequent or become a problem in your life. So there's such a variety of issues, but think pain, think something you did like repetitively or unexpectedly resulting in pain. You need to have a strategy to deal with that. Now, historically, the strategy has been to rest, to ice, potentially use compression, and then to elevate the area if it's something that's you're dealing with some inflammation and swelling and edema and stuff like that. So that protocol has been with us for a long time. In fact, like if you take ankle injuries, for example, an ankle sprain, they used to cast you. If you had a pretty moderate to severe ankle sprain, you would go and get casted for like a week, and then you'd be on crutches. Like, okay, you're off that ankle, you're on crutches, you're booted, and we want to get away from that. Sometimes that's maybe necessary, but a lot of times the issues we're dealing with are something we can be more active in dealing with. So we want to promote healing. We want to hijack the healing process, I guess, to have a situation that you heal faster and heal stronger. Okay, so we want to think about ditching the RICE protocol, the rest, ice, compression, elevation. We want to ditch that. We want to have a new strategy that you can implement. The first part of the strategy is to move. So movement is key. So that's the number one thing we want to do. When you have an injury, one thing that your body is going to want to do is protect that injury and not move it. So you have to mentally overcome that barrier and move the area that's injured. So movement will do a couple things. Movement will help with fluid exchange. So it'll get the kind of the inflammatory cellular debris out of the area and bring in more blood that contains nutrients to help heal an injured area. So movement is critical. A lot of times movement requires weight bearing. If you have an injury to your legs or your extremities, your lower extremities, movement is going to require you to use it, to stand on it, to walk on it. And so that stress on the ligaments, on the tendons, the connective tissue, the fascia is going to help promote healing by stressing it in that way. So movement's key. Number one, when you get injured and you protect that area and you don't move it, it's going to stiffen up. It's going to become fibrotic. It's going to become a situation that you're going to have to move later, and it might be more challenging. So it's going to be really important to keep it moving. Step two, after you have an injury, is to start exercising it. So you may have a knee injury. Let's take, for example, let's say you weren't exercising your knee, and then you all of a sudden injure your knee. If you don't exercise it, most likely your knee is going to eventually recover from that injury, but it might be weakened. So you're going to come out of that injury with, if you're not implementing these strategies, you're going to have a knee that's now maybe compromised in such a way that now it becomes a problem and it becomes this recurrent thing. And so you definitely want to respect pain levels. You want to respect movement is the key strategy first, but then you want to start exercising that region that's injured. And exercise is going to do a couple things. It's going to increase circulation. Same thing with movement. It's going to bring blood into the area. It's going to remove debris and damaged tissue. And it's going to place a stress on that area in order to get it stronger. So you can think of it as a critical step that you have to time correctly. But pretty soon after an injury, you want to start exercising it, which means when I say exercise, I'm thinking strengthening. So you're going to apply either your body weight or like an external weight, like you're going to lift something more than your limbs weight in a situation that you can do repetitions and sets, and you're exercising that area to try and get it back to where it was, and maybe even stronger than what it was. So that's going to help repair and remodel scar tissue that forms as a result of injury. So if you're not exercising it, you're not strengthening it during the healing process, those areas that are injured can potentially become a problem for you, kind of like lack of movement. So you have to add exercise to the area. The other part is dealing with pain. So you need a strategy to deal with pain while you're healing. This is where a lot of different strategies can come to play. You can use nutritional strategies. You can use herbal strategies. You can use topical cream kind of analgesic strategies. But it's definitely an important part of the healing process to deal with the pain, because a lot of people like to use ice and then not move their injured area in order to avoid more pain. And you might find that if you injure an area and you add movement and add exercise, that you're going to be in pain doing that. So you're like, what do I do about that? That's where analgesics come in. You can do internal analgesics, like a popular one for pain is turmeric. So the curcuminoids in turmeric are anti-inflammatory, for example. Another popular one is vitamin C or magnesium. These things can be taken internally to reduce some of the pain that you're dealing with while you're healing. Arnica is an herb that you can take that can have anti-inflammatory properties. You can also use topical strategies, strategies that you can apply to the area. Capsaicin, menthol, camphor, these can be found in topical products like that you find at the drugstore that are in your pain and first aid aisle. There's a variety of name brands. I'm not going to mention those brands here, but they're really good to use. They go on the area. A lot of them have anti-inflammatory properties. And the cool thing about them is they're formulated in such a way that your skin will actually bring them through the dermal layers and into the area that's injured. And they have really cool effects on regions for pain control. And so movement and exercise are going to cause pain to an injured area, but you have to do it to heal correctly. So you need an analgesic strategy to accompany those things to help mitigate some of the pain about that you're going to experience by not resting and not icing. So analgesics are really important. And then the last part of your strategy dealing with an injury is treating it. So treatment goes into those categories of like passive modalities, things that you do that aren't active, but can play a really important part of the healing process. So I think of the treatment aspect or things that I do as a chiropractor. So when someone has an injury, they'll come to me and I'll give them movement and exercise strategies, analgesic strategies too. And then I'll usually do a treatment on the area. And that's a passive thing where you are on a table passively getting therapy on it. And those therapies can be really helpful in the healing process as well. But I don't think it's the most important part. Like I said, movement and exercise are the key things to do. And then analgesic stuff to deal with the pain, and then treatments like by a massage therapist, chiropractor, physical therapist. We all do a variety of things, and some of them may be more active, but typically you're going to be dealing with passive stuff. Now, once you learn some of those treatments, let's say I teach you some of the treatments in my clinic, you can apply them at home and reproduce some of the same passive treatments to an area. For example, you can do your own self-massage on an area to kind of deal with the pain. Heat, that's a passive modality. TENS units can be helpful. Joint mobilizations, range of motion exercises, some things like that can be used kind of in a treatment modality aspect. And so these are personalized strategies that go with you as the person and your specific injury. You're going to do different things if you're injured in a car accident than if you sprain an ankle, obviously. But treatment is definitely an important part of the aspect of healing that you can't discount. Which brings me to my next point. Everybody needs a healthcare team to deal with these little things as they come up. So when you get an injury somewhere out there in the world, you need people you can turn to that can appropriately help you along and give you advice. It may take a couple different people. If you get in a car accident, you're going to probably need to see your medical doctor. You might need to see your chiropractor, a physical therapist, a personal trainer, massage therapist. It's good to have a team of people you can turn to when these things come up. So you need a team. And then you need to keep track of what you're doing and then try and reproduce it. So think of it as your own little science experiment. If you are doing range of motion exercises to an injured ankle, keep track of how many times you do it, what it feels like while you're doing it, and after you complete your exercises. If you're doing exercises, let's say for an injured shoulder and you're lifting a weight, you need to keep track of your repetitions, your sets, how many sets you're doing, how much weight you're lifting, so you can reproduce those things over and over again until you've accomplished your goal of rehabbing an injury. So that's important to keep that in mind. Here's a couple of very specific things to do for the different body parts that get injured. Now, this is not the end all be all list, but I recognize the fact that not everyone hearing this message will come see me. So it's good to have a little bit of an idea of what I'm talking about. So if you have a foot ankle injury, I would recommend writing the alphabet with your toes. So simple as that. That'll get you movement. Usually you have to it's a little bit of an exercise because your foot is off the ground elevated and you're going against your own body weight. So you might get a little tired doing it. So that's a good thing for the foot and ankle. For knees, I like stationary biking on a low tension setting where you don't have a lot of resistance in the pedals. So that's a good way to get movement and a little bit of exercise onto an injured knee. For a shoulder, I like a couple things. One is pendulums. So if you've ever had to deal with a frozen shoulder, you may have been given pendulum exercise. That's where you hold a light weight, let your arm hang down, and you kind of swing your body to get your shoulder joint moving in kind of a circular fashion. And you might go clockwise and counterclockwise. You can also walk up a wall, so you get a nice passive motion. If you find a wall, you can finger walk up the wall until you feel like you're getting a good stretch, and then you come back down and you walk back up. For neck pain, I like shoulder shrugs and circles. Not aggressively. If you're doing that too aggressively, it can kind of backfire on you. So circular motion with the neck and shrugging your shoulders either together or one at a time can get the movement necessary to help rehabilitate a neck injury, at least at the beginning. And then for back pain, specifically low back pain, for the movements, you're going to want to do things like walking, yoga, gentle yoga, and potentially swimming. If swimming is part of your overall healthy lifestyle strategy and you have access to a pool, swimming can be really helpful when you have back pain because you're taking the pressure off the back and you're not weight bearing, but you're also moving that area. So those are specific regions of the body that often get injured and a couple strategies to deal with them. When you have injuries, to recap, avoid resting it too much, avoid too much ice. don't compress it. All those things are antithetical to the healing process. We want more blood flow. We want to move the area. We want to stress the area with exercise in order to remodel that tissue and get it healthy. You want to deal with the pain using analgesics rather than, like, let's say ice, which could be considered an analgesic, but topical cream, internal kind of herbal strategy of analgesics. And then you also want to incorporate passive treatment modalities. You want somebody to massage it. You want to do maybe some more passive joint mobilization or joint manipulation to an area that's injured. And then don't forget the delta time. So delta T is an important factor for injuries. If you have an injury, it's going to take time to heal. And like a mild injury is going to take you 2 or 3 weeks to heal. A more significant injury might take you 3 or 4 months to heal. If you go through this process, not realizing that the body has to take time to heal and remodel tissue and repair tissue, you can get frustrated. So don't get too frustrated if you apply these strategies and it doesn't seem like it's working within the first couple of weeks. It does take a lot of time. So I'm open for questions. Hopefully that's a helpful message. And let me check the chat. And hopefully there's a couple questions in here. Does anybody have any questions? Hips.
I have one
Depends on what
question.
type of hip we're talking about.
Oh, sorry.
If you're talking about the hip, like your glute region, think low back. If it's hip, like your hip joint region, stretching your hip flexors, kind of a lunge-based stretch. You can place a pillow or a foam roller under your sacrum and get a good stretch and mobilize your hip. So pendulums also are nice. If you find a step, you can gently kind of swing your entire leg and mobilize your hip joint. Hips are a little bit more challenging to apply analgesics to. So if you have a hip issue, I usually recommend people use like internal analgesics, curcuminoids, vitamin C, magnesium. Those types of things can be really helpful. Arnica, internal arnica, because the hip joint is deep and getting there with heat doesn't really work very well. So mobilizing it with pendulums, like getting your leg to be a pendulum. Sometimes people with hip pain do well on a stationary bike, just mobilizing it that way. Swimming can be helpful too. So, and then hip exercises are like deadlifts, squats, lunges. So variations of those, step ups, those types of things. And there's a whole variety of ways to do exercise for the hip. So mobilize first, movement first, then build some body weight exercises. And hips are a little tricky, but good point to bring that up. I kind of skipped over that, not on purpose. Thank you. Any other questions? Believe it or not, this is controversial. Most people, they get injured, they think, oh, I got to ice and rest this thing. Don't do that. It can prolong the healing process, and you can heal in a way that's not helpful. So you might heal, but then you have a weakened area. So the person who came up with the RICE protocol, I think, has given lectures or talks that's probably not the best advice. So the old adage of like, okay, I have an injury, I got to ice for the first couple of days is still really prevalent. And that's what I was taught. But in the last couple of years, I'd say the last 5 years, it's really taken a new turn. So instead of ice, you heat it. Like if you have an ankle injury, don't put ice on it, heat it right away. And that might go contrary to what a lot of us have been taught. So, all right. Oh, meniscus tear injuries after surgery heal with meniscus being replaced. That's a pretty technical question, Alexis. The meniscus is living tissue. It doesn't have a good blood supply. So you can, in my professional opinion, heal meniscus injuries pre or post surgery. But post-op surgery, you're dealing with maybe more of a, that's technical. It depends on the meniscus tear. There's like 10 types of meniscus tears. Taking the whole meniscus out is something that can happen. Bucket fold tear, medial or lateral? Probably medial. The bucket handle is a tricky one. So think of it like this. Don't think of the meniscus by itself. Think of the knee. And then think of range of motion. Like, okay, you have a meniscus tear with like post-op issues, and do you have full flexion? That's like, can your knee flex all the way? And if you can't, that's like a good place to start, getting your full range of motion back, and getting full range of motion back, and then doing exercises to strengthen the knee in general can be really helpful. And those exercises are not sophisticated. It's squatting, it's lunging, it's deadlifting, it's doing step ups. So those are my 4 go-tos for any lower extremity strengthening. You can use machines, but I like body weight. Heating the knee, doing pendulums. Like if you sit on a countertop and let your legs dangle, and you kind of swing your legs gently with a little heat on it, that can really increase the circulation and help with post meniscus based knee pain. So great question, tough. Popping and clicking go away or be less or more. So popping and clicking from a knee can come from different structures. So you want to think there's an imbalance probably somewhere in the knee. So the knee, you've got the lateral and medial structures, they kind of compete with each other. So think like lateral structures would be like lateral quad, IT band, competing versus the medial quad, your VMO, and maybe like medial hamstring. So there might be some imbalances there. And so what I would do in the clinic is identify like where you're at with those muscle imbalances, and then give you strategies to like deal with that. So if your VMO is weak, we strengthen the VMO, or if your lateral like knee soft tissue is overly tight, we can use strategies to stretch it out, or maybe get it to be more elastic in nature. And usually the popping and clicking, everyone's different, but a lot of times it comes from patella. So your kneecap will pop and click as it tracks inappropriately on the femur, which means you may need to not worry too much about the popping and clicking, but identify structures in the leg that are not correct. Like, you know, the foot and the hip and the low back play a factor in like a knee pop and click. So if you have a tight glute, for example, on that side, that can affect the knee, believe it or not. And so sometimes looking at like 1 or 2 joints away from the area can give you a clue on what might be popping and clicking. So popping crepitus and popping and clicking and noisy knees and stuff, it's a variety. You could have, you know, arthritis in a knee with a bunch of spurring and frayed tissue that can make noise. So the structures that cause noises in the knee are a couple different things. So, you know, more technical question. I would love to see your knee, basically. But yeah, I mean, if the popping and clicking cause pain while you're doing the exercises, I would avoid. Any pain during exercise is kind of risky. If you're popping and clicking through your range of motion doesn't cause pain, I think it's probably on the safer side, but it's hard to answer that question with a lot of specificity. So yeah, you could talk to me later off the call and get more specific. It would be good to look at a chart and see stuff and then do an exam on the knee. So good questions, Alexis. Did I answer that question? It's a tough one. All right. Well, have a good lunch, everybody. Thanks for joining. I appreciate everybody who came and listened, and hopefully this is helpful. And injuries happen. Don't get bummed out. Remember, it takes time to heal an injury. Just during the healing process, you have to be really active with your strategies in order for it to heal appropriately, so you don't have a problem after and then have to deal with that. Okay, so take care, everybody. Thanks for joining. I'll see you next time.